Today we're going to talk about exercises you can do when you have pain in the upper trapezius area. Frequently, I have patients come in and they have pain in the upper trapezius, especially when they reach for something overhead. There are three categories of exercises for treating upper trapezius pain: massage, stretching, and strengthening. Massaging and stretching are a great short-term symptom relief method, and strengthening is the key to long-term relief. Part 1. Massage. Most of the self-massage techniques for upper trapezius is a variation of trigger point release. Channels such as SpineCare or Physical Therapy 101 recommend using your index and middle fingers to perform these release techniques. However, I did see a Bob and Brad video that recommends the use of a theracane shoulder massager for this purpose. The biggest difference between the techniques used by SpineCare and Physical Therapy 101 is that SpineCare uses the neck side bending head movement during the release, while Physical Therapy 101 uses a neck rotation movement during the release. SpineCare also recommends the use of a tennis ball to release the rhomboid muscle trigger points. Part 2. Stretching. Stretching of the upper trapezius is a very common exercise prescribed for both upper trapezius pain and neck pain. SpineCare recommends stretching of the upper trapezius as the second part of their 3-part video right after massaging. AskDoctorJo also recommends stretching the upper trapezius for the purpose of relieving neck pain. Part 3. Strengthening. SpineCare, Physiotutors, and Bob and Brad all recommend some form of upper trapezius strengthening. SpineCare and Physiotutors recommend the same exercise. SpineCare called it the shrugging liftoff, while Physiotutors called it the overhead shrug. Both Physiotutors and Bob and Brad recommended the monkey shrug exercise, except the Physiotutors demonstrated the exercise using dumbbells, while Bob and Brad demonstrated using resistance band. Both Physiotutors and Performance, Sports, and Spine recommend monkey shrugs and weighted lateral raises. For my patients, I want to normalize the tension in the area first, so I would always recommend massaging and gentle stretching. For self-massage, I do confess that I utilize the release technique recommended by SpineCare, where you put pressure on the muscle while side bending the neck. Strengthening. This is where I differ from these therapy channels. I actually don't like the idea of strengthening purely the upper trapezius. The way I was taught in therapy school was that the trapezius muscles and the rotator cuff muscles have to work together to create balance. If the upper trapezius is hyperactive or overly dominant, you have to teach the upper trapezius muscle to work with the other muscles of the shoulder. When I see exercises like monkey shrugs, it just looks painful because it's purely upper trapezius movement. It doesn't do anything for shoulder muscle balance. When I look at overhead shrug, it's not as bad because in the position that is demonstrated, you can also activate the lower trapezius muscle and the serratus anterior muscles to work together with the upper trapezius muscle. My personal favorite exercise for balancing the shoulder muscles is a single arm lateral raise. However, I like to position the arm such that the thumb is pointed up to engage lower trapezius muscle better. I teach my patients to do this movement without shrugging their shoulder. If you do this movement while shrugging the shoulder, your upper trapezius is doing most, if not all, the work. However, if you do the movement without shrugging your shoulder, your upper, middle, and lower trapezius are all working together in balance. This is especially important for individuals suffering from shoulder instability and shoulder impingement syndrome, where even a slight bit of shoulder elevation will set off intense sharp pain into your neck and your arm. I tell my patients to do the single arm lateral raise in front of a mirror. I ask them to watch the space between their shoulder and their ear. If that space shrinks as they raise their arm, they are shrugging the shoulder and should start the exercise over. They have to try to do the exercise without shrugging the shoulder. I ask them to just raise the arm to the point right before they feel like they have to shrug the shoulder, then lower the arm immediately and start over. If they do it this way, eventually the muscles will get stronger enough to the point where they can raise the arm higher and higher without shrugging. If you're wondering why I'm recording in the car instead of the usual spot, well, it's because when I record at home, I usually do it after everyone goes to sleep. Recently, the kids have been sick, so we've been having some trouble putting them to sleep. So there's some times when I just don't get any sleep, so I end up not being able to record at home at all. So this week, I'm recording from the car between work and going home. And yeah.